Welcome to the Diversity Connector podcast, where we explore the rich tapestry of human experiences. I'm your host, Gertrude Mache, and I'd like to acknowledge the traditional custodians of the country on which we meet today. I would also like to pay my respects to elders, past, present, and emerging, and together as we dive into conversations that bridge cultures, challenge stereotypes, and celebrate the unique perspectives each of us brings to the table. Each episode is a journey through stories and insights from a kaleidoscope of voices, each sharing their colorful narrative. Whether you're at home, on the go, or just anywhere in between, you're now part of a community that values understanding, inclusivity, and the beauty of diversity. So plug in your headphones, get comfortable, and let's connect through the power of our shared stories. Welcome, and thank you for joining us on the Diversity Connector podcast. Hello, everybody, and welcome back to the Diversity Connector. This is Gertrude Mache here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another fascinating woman. Welcome, welcome, welcome to our tribe. Please tell everybody your full name, where you're based, and share your story with us today.
Thank you, Gertrude. Thank you for having me on this show. My name is Abiola Akinbiyi, and I'm originally from Nigeria. Migrated to Australia about 22 years ago, more than 2 decades now. So, look, it's been an interesting journey. I'm a mother of two. I'm a healthcare professional, a community advocate, and a child of God. And coming to Australia, I think when I first heard about, my journey into coming to Australia was quite a little bit strange because I didn't have the intention of coming to Australia, because when you're in Nigeria, it's always England is very popular, United States is very popular. And I remember my husband got a job in Australia, and I was like, where's that place? So the first thing that I noticed about Australia when I was talking to my grandfather, it was like, oh, there's some people that live in Australia. He was talking about the Aborigines, the First Nation. And I was like, no, I think you're wrong. That's the wrong place. I'm not talking about that place. And he brought out this book called The Atlas. And he showed me, was because my grandfather likes to keep history. And he showed me about a lot of things about the First Nation. And I was so fascinated and excited. So we came here under a skilled migrant, thinking that we're going to go back within 1 year. And when we came back, we loved it. Have my kids here. The journey at the start was quite rough, but like a skilled migrant, there's some expectations that you have with the Western world. Because when you're migrating, there's so many things that you have to think, you have to digest. A lot of histories and stories being shared back home that you might actually not get the job that you were doing back home. You might have to start from the scratch. And those kind of, expectations, we prepared for it. And when we got here more than 20 years ago, it was a different story. There's a different narrative of when you heard about something, when people tell you about it, and when you find yourself, right inside that particular environment. To me, it was quite tough because I was initially working in Nigeria, came in here, started looking for a job, and the skilled migrants, the educated part of me was applying for a job like a manager, supervisor, something that I think I'm qualified to do. And after about 60, probably 60, 70, I still kept that file up till now of rejection, saying, oh, your application is so good, you're well educated, blah, blah. But unfortunately, you're unsuccessful. So I have this so much unsuccessful story. Spoke with a lady and she said, what about, you have to do a skill assessment where you assess your skills, you assess your education and see which part, if it's, equivalent to Australian standards. Went through that, done that, and I was told to go to, probably get some skills in terms of education. And during that time, it was an exploitative state, and an exploitative state that I think many migrants, skilled migrants or refugee knows better, that when you come in here, it's quite tough. in getting a job. I just want a job. I just want to be useful. I just want to add value to myself and the community that I belong to. And at that time, there was not that much big Nigerian community. So, and I remember saying to myself, there's always a saying back home that when you get to a place and within 3 months you don't see a Nigerian, just leave. That means that's not a good place. It was so funny. It was just a funny kind of joke that people used to crack back home. And I couldn't see any. And I said to myself, I think it's time to go back home. I think 3 months or 4 months after I went back, my husband stayed because I was just like, there's no prospect in here. And later I went back home, tried to do one or two things, and I realized, you know what, let me come back and try all over again. Came back, met a fellow Nigerian on the bus, which was good. And he told me about, getting a job in healthcare. At that point in time, I was just ready to do anything. Um, and I got a job. I went to, I think, but 2 or 3 week school. There's a certificate 3 in HK. That was when I was supposed to start my master's. So went to the uni, talked to the university. Then because I had a Bachelor of Mathematics coming here, and I wanted to do my master's or postgraduate in IT. And then I realized there's no way to knock in a door for any organization or any opportunity of getting a job without having an Australian qualification, because that's some of the things that I've got as a feedback. And I'm always a kind of person that, whatever kind of feedback it is, positive, negative, if I can actually work on it to make myself a better person. So went to uni, was doing that, personal care attendant job on the side. And coming from an IT and mathematics background and working in aged care, which is an health industry, it was quite two different things. But there's one thing I've learned working in aged care is, even though sometimes at that particular point in time, many people that are working in aged care, migrants, refugees, some of them are professionals, doctors, lawyers, but just want something that you have to settle for because that is where the job is at that point in time. I just see it as a different way of learning about life. And because I didn't grow up with my grandmother died before I was a teenager. And I just saw a different aspect of life in terms of seeing a lot of people that have worked all their life. It was quite daunting for me because it wasn't something that I was used to. Back home, when you're looking after the elderly person, it's always in their house, your grandmother, your grandfather. I wasn't used to having, seeing an organization or a place, a residential aged care facility with a lot of elderly people in there, residing in there and living in there, and people looking after them. So the job was quite challenging. There were lots of ups and downs, so many downs in terms of the way people looked at you, the way you're being perceived. Nobody see the skill, they didn't see the education. They just see you as, someone from Africa, a black person, no skills, something that's very, the way they talk to you is a bit degrading as well. But for me, I have different focus. I know I was doing my master's, was doing my master's in IT, trying to get my feet. I was just looking for a job. Sometimes because you have a lot of responsibility back home. So, like I was saying, at that particular circle, working in HK taught me a lot of lesson. I've learned about different people's life story. The elderly people that I work with, it's just a different cohort. You see the educated, the skilled, people that circumstances has changed their life in terms of the staff, the residents, and even the organization policy as a whole. And when I finished my postgraduate diploma in IT here in Australia, I went back to do my master. I was looking for a job as well after that postgraduate diploma. And they were like, oh, what if you just have like a kind of, degree in software engineering, blah, blah. And the bar just keep changing all the time. And I'm like, you asked me to do this. I've done that. You don't have an Australian, qualification. Here is it. You don't have an Australian degree or skills or work experience. Here is it. And still, it's too difficult to get a job. So I went back to do my master's. So while I was doing my master's, I fell in love with the healthcare industry. I really wanted to make a change because there's so many things that I see in there, in terms of the policy, diversity policy, in terms of, how people are being treated, in terms of the knowledge base of personal care attendants and their expectation to look after the elderly without that much education, with a 2 week crash course. And I just want to make a change in that place. And I said, look, when I finish my master's, I might actually just go into healthcare. Finished my master's. I was 6 months pregnant. And I said, oh, there's a lot of people when we are working in aged care that's when you come in as a personal care attendant or a PCA, like they popularly called it, you will understand how the thing work. You come in, they have to share the workload, and sometimes you get the heavy workload. I'm not sure whether it's a kind of bias or perception from my side or her side or whatever side that but to me, I just felt as if we're being given the more difficult patients all the time. Um, and we just have to deal with it because yes, if you complain, you can't complain because you're there to do a job. And then I just realized like there's so many things that we can change. People want to make their life better, but they're stuck into that working as a personal care attendant. Don't get me wrong, is PCA are one of the most valuable most valuable skilled and employee in an aged care facility, and that's um, a story for a later time. But and working in that and see how people of color are being treated, how PCA are being treated, and how someone would just come in who is a team leader or a nurse in charge, and we just come in and said, you go here, you go there, you do this, and you can't complain. There was so much authority, so much power, and so much fear in migrants that are working in that space as well, because we're not used to challenging people of authority. So for me, it's a different perspective that changed my life. It takes me to another place in my life journey that I've vowed to make it better, to improve the life of the workers in healthcare, and to look at the life journey of the people that live in that residential aged care facility. They're elderly people that have supported this system, work hard for the kind of empowerment, the kind of benefit that we have at the moment. Although we might be of different tribe, they might be Caucasians, they might be Italians, they might be Cowed from Cowed community, but I believe they've contributed a lot because having talked to them while I'm feeding them, I heard about their life journey and I said they've contributed to the Australian community. They deserve better than being treated in a way that it's not appropriate and it's not humane. So to me, it's about empowering people to do their job properly and empowering the skilled migrants and other people, cloud community, women, because it's a women-based, it's very, very women-focused job. And to be able, so I kind of tried my best after I finished my master's, did a Bachelor of Nursing, different story of how I started that Bachelor of Nursing. And people were quite surprised because I came back after my first daughter as a nurse. And they were like, how did you do it? From PCA to a nurse. And that was why I had the opportunity, empowered myself to be able to change things. Because I realized you can't change things when you are at the bottom. You will always be fed. You can't feed people. And that kind of, that's how my story started in healthcare.
Wow. Abiola, your journey has been absolutely incredible. Now I understand how you became the founder of Changepreneurs. So, what significant changes have you observed in the career trajectories of young Australian African women who participate in your programs? And can you share a success story that stands out for you in particular?
Success stories that stands out for me. Honestly, if I'm to be very, very honest, all their success stories are very they stand out for me because some of them I've known them since when like 14 years, 15 years. Some of them I know them since when they're 12. And every year there's always a success story. I was talking to one of them yesterday who just recently obtained a CPA. She became a certified practicing accountant, still an international student, still trying to. For me, I think if I had to group them together, because I don't have a unique particular success stories, because they're
Yes.
all very special to me. So for me, is their journey, looking at where they started and how little bits of support and guidance can go a long way. So initially, I didn't even plan to start Changepreneurs. I was just in my community, minding my own business, trying to find my own feet. And I've already found my feet a little bit, but I'm a kind of person, I'm a giver. I'll give my time, my energy, wherever it's going to make an impact. And I got a text from one of these young lady, a teenager said, Auntie Abby, can you be my mentor? I'm like, what? Like, ow, I'm just trying to navigate my own life. And but I was actually happy that someone can see me in that way. And because we had a program in talking about mentoring. So they text me and I was like, fine, look, whatever you want to do, I'll go on the journey with you. Um, 3 days after, I got another text message. Auntie Abby, I was just wondering if you're going to be my mentor. And they're two different people. They're three different people. I got three in a matter of about 1 month. And I'm like, I must be doing something that's impressing this young lady. I don't know what mentorship was all about at that time. I was just ready to go on their life journey with them. And if I had to share that success story that you talked about, right now, the three of them, one of them is a qualified psychologist now,
Oh, wow.
practicing. The other one, as a call to bar, was called to bar last year and was called to Australian bar this year as well. We went to the first degree because that one was probably one of my unique success story. She was my first mentee, and she keep on talking about, yeah, oh, she's gonna be in this music industry. Will I am? And I said, no, you're gonna be a lawyer. She said, no, no, Auntie Abby, blah, blah, blah. She did this. And she did another degree in like music or something. I said, no, you're going to be a lawyer. She said, yeah, I want to be a law. I want to do law, but I'll see how I go. So,
Right.
it was a long story from Australia to New Zealand. She found herself in New Zealand because I said, if Australia is not working for you, you grew up in New Zealand, why don't you just go there?
Yes.
And yeah, but now she's a lawyer. She's a qualified lawyer. Went through, she did her first degree in a different course. I was at the graduation and I was
Yes.
like, we're gonna still do this law. And watching her signing that, call to bar was a different story. And the third one is now a registered nurse. She completed her Bachelor of Nursing last year. So watching how the three of them has evolved, we've got a lot of people, people like, a lot of them. I've got people that won entrepreneurship award. We've got
Mm,
people that have been a board of director who are now vice president of Changepreneur. So for me, it's about giving them ownership.
wow.
So the success story for me with all the changepreneurs is to see here, now, and what's next. So when I
Right.
compare then with the now, and I look
Mhm.
at everybody, and I'm not joking, we have 100% success rate. So
That's
it
just,
wasn't nobody's left behind.
that is absolutely incredible. So, with over 20 years in healthcare,
Yeah.
how do you approach incorporating DEI principles in healthcare settings, especially in aged care and mental health services? And again, can you provide an example of a project or an initiative that you led that improved the outcomes for culturally and linguistically diverse populations?
So we look. It's a um how will I say, it's a very complex situation. And I always say too, maybe probably the way I was being brought up to be very open-minded. I always say, do not associate with malice where incompetency will do. Because sometimes in healthcare, there's a difference between knowing from reading policies, stories, and actually being in that space, coming with a lived experience. So
Right.
sometimes we have a lot of policymakers. It's probably like a desktop research analysis, having a look at all these things, what work, what does person say. But it's very different. But between when you have someone with that lived experience who's still living that experience. So when I say living
Yes.
experience, it's a continuous thing. It's a life thing. It's something that has its own momentum too as well. So for me,
Yes.
coming to that space and introducing diversity, equity, and inclusion has always been part of any organization, policies. But how well do they practice it? How well
Yes.
do they kind of implement it? Who's quite aware of it? That's one thing. So coming into aged care perspective, like what I said earlier on, when I become a registered nurse, I want to be a clinical educator. I just find out like people there's education that is needed. Like Nelson Mandela always say that education is the most powerful weapon to change the world.
Mm,
So for me, when I was gonna do that nursing, I knew my pathway was education because I see
right.
a lot of things that was wrong. So because I was able to do it, I was 6 months pregnant when I started nursing, navigating and successfully, just completing my bachelor's. Because when
Right.
we sit down um at the lunch table all the time, there's always this perception it's very hard to study here. It's
Yeah.
always hard. You can't do it. Maybe we should just do certificate 4. Maybe we should just be a division 2, which is like a diploma of nursing, because bachelor is very hard. But I always say no. To me, I was, when they said when the going gets tough, the tough gets going, and to me, I was like no. So because I did it, so I kind of find another pathway for them, because we're always given the heavy patients. So what the kind of policy I brought in, I was like, okay, fine. These people are not nurses, but we can do what they call medication education. They don't
Wow.
have to know anything about the drug, but they have to know the 5 rights of medication: the right person at the right time, the right medication, um, the right dose, and giving it at the right time. So,
Okay.
and that's one of the things I brought into that organization. Like, let's start doing medication training for personal care attendants. And what that does is, even though you are not a nurse, it gives you that feeling when you're pushing that trolley and you wanted to thrive more. And all
Yeah.
the education that we're doing as well is about, I started initiating cultural competencies into those education. You can do, food hygiene. You can talk about diversity. How do you greet patients? How do you greet residents? But the thing is, you have to understand their culture. If they're
Right.
from Italian background, you have to know what language to use. I'm an African. I
Yeah.
can up to now I can't see. Even when I'm writing you an email, I'm like, I get through. I still feel a little bit, because I'm from Africa. We're used to and respecting the elderly. So
Yeah.
when I get into that, I start teaching people. I want to know about their culture. So we start teaching people about people's culture, so that enhance how they look after the people in aged care facility, and at the
Mm,
same time, the staff who are from diverse background. How do we enhance the education, not just stopping at that certificate 3? So we start doing in-house courses.
mm-hmm.
So some of those in-house courses is to talk about the diversity of everybody that you're looking after, and the staff as well, to understand the communication between staff. And the other thing is to have um a diverse set of employee. So when you have an organization whereby people at the maybe mid management or top management are just probably Caucasians, or people that are from established background, there have
Mm-hmm.
to be a way whereby you bring people with minority group into that space. But you can't
Yes.
just go pick someone help. You need to find a pathway to educate them, a pathway to empower them, a pathway for them to be able to be part of that cohort. And that is why sometimes I think the established community and the new emerging community have a clash, that
Yes.
Rome was not built in a day. To me, I
Mm,
understand the pathway. I've studied here in Australia with about 6 university degrees. So I know that you will not just be hand over the key. You have to work for it. But I'm
yeah.
ready to work for it, but you have to create a pathway for me. So I
I love
cannot walk for a place where I cannot see the road. So
it.
you have to
Yeah.
create the road map, and
Love
tell me,
that.
and then I will trail it myself. So I'm sorry. So that's so
So
all those
let's
a particular project that stand out for me, especially in that particular healthcare in the healthcare space, was when we did it's called an education framework. So in that
mm-hmm.
education framework, what I introduce is the cultural competency framework as well. That whenever
Right.
you get to people's room, you don't just start covering your nose or stuff. You have to be a bit, emotional awareness as
Yes.
well,
Yeah.
and at the same time, how to talk to people from, especially people from Africa, and how to talk to people from Italy, how to understand people's culture and respect that space.
Okay. So let's talk about cultural competence in business. From
Yes.
your experience as an entrepreneur, what strategies have you found effective in building culturally competent businesses that not only celebrate diversity but also leverage it as a strength?
Look, I think cultural competencies in business, it's it's very hard, especially when you're dealing with people of your own cultural background.
Yes.
Remember, Africa is a continent, and
It's a very
sometimes we just make an assumption as if it's a country. So the cultural competency, especially when it comes to, owning a business as a people of color, and I always make this. This is my own part of making the joke, is that particular kind of discount. When people
yeah.
tell you about this is my price, but you're used to back home, you have to keep on pricing this. Sometimes in it does rub off on people that are not from Africa,
Yes.
because and you keep going on and on. Look, I need a discount, and sometimes people really really get pissed off with it.
Yeah.
And to me, is to understand when you come to that, leverage the cultural competency in business is you have to understand both worlds, because your business is not only serving your community, your
Yes.
business is serving the global. You have to think about what kind of business you're running too. So no
Yeah.
matter what business you're running, it has to serve a whole diverse community, and you need to understand that space. So for me, it's about understanding that space, and that space comes with structure. When you're
Mm-hmm.
running a business as a people of color, with all due respect, structure is not what we're used to. We're very
No.
fluid. So,
No.
understanding that structure, that there have to be a structure in place, and the
Mm-hmm.
structure that you have in place has to understand the kind of cohort of people that you're dealing with in terms of appointments. People coming early to appointment, people coming late to appointments, in
Mm.
terms of pricing. How do people welcome bargaining? There's sometimes you go to a particular country, they say bargaining is welcome. There's
Yeah.
sometimes it's not welcome. And the
Mm-hmm.
other thing about it is again is your workforce. If you
Right.
could try to engage different communities to be part of your workforce, no
Yes.
matter whether what you're doing is probably something that serves just a particular one community, it's always good to have that, over different lenses
Mm-hmm.
into your businesses and into the corporate world. So, and because that gives it the richness. So the cultural competency is to have a cultural competency policy as well,
Mm-hmm.
written, not just perceive, not just
Yeah.
something that you verbalize. You have to have. And there's a particular project that I was part of, that the Victoria University launched last year. It's about the staff and the students when they
Mm-hmm.
come in to be part of the orientation program. So
Right.
cultural competency is not something that you're learning when you're already working. It has to be part of the orientation program. People have to know what is the do's and the don'ts, and it evolves, it changes over time. So I
Yeah.
always say charity begins at home, starts when you enter. And whenever your employee comes in, have a policy in place that tells them how to run the business. And it's not as rigid paper, it's a
Yeah.
fluid it's a fluid document. I think it has to be a living document that is changeable.
So I've got two more questions for you before we end the interview.
Thank you.
Having served as the Victoria Multicultural Commissioner,
Mhm.
what role do you believe government and policy play in advancing DEI? And what policies would you recommend to enhance social coherence and multicultural acceptance?
Look, I think with the Victoria Multicultural Commission, they kind of serve as, like, a conduit between the government and the people.
Yes.
And when you look at that space already, it's, to me, I've always believed in every little step.
Yeah.
I appreciate every little step. Sometimes we want a bigger step. And I think what one of the things that they're doing at the moment is to engage with different community. They have what they call regional advisory council, where
Right.
about 8 different regions, and they kind of get community leaders, people from different communities to be part to inform the government of what is happening in their region. So I think
Right.
that's a fantastic structure. But maybe they probably need to improve to increase the time where they meet, because I think the meeting time is quite a little bit longer than each other, probably 3 or 4 meetings in the year. But they do
Yes.
have different cohorts of people that informed the commissioners, and the commissioners informed the government about what is happening in different regions. So, and it's not only in the metro, it's also in the regional area as well. So each region, we have northwest, and I think and how to leverage on that is just, I think it's a huge selection criteria. It's a tough selection criteria to get into that regional advisory council, but at the
Right.
same time to see whether they are connected to people. So those people have to be connected to people. One thing. Then
Mm-hmm.
the other kind of strategies that I think what policy that they can put in place is leveraging on all these stories that
Yes.
we've all heard.
I
So
love
I think storytelling is not just for, and that's why sometimes when people say, "Do you want to come and tell your stories?" Sometimes I'm not that interested, because
it.
I said, after the story, then what? So I think the
I think
quality
the
of
story
everywhere.
is a sense of inspiration. You know, you've kind of led the way for others to follow. And until you see someone like you in positions like you've had, I couldn't believe I could do it. So I think that's where the power of sharing the story really comes. So, my final question for you is, looking ahead, what emerging trends or challenges do you foresee in the DEI space? And how should organizations and communities prepare to address them?
Look, I think the trend that I'm noticing at the moment, it's more of it's this deep systemic racism and
Hmm.
discrimination. That it's I think because there's so many policies in place, you can't
Yeah.
pinpoint them. So you have to be very careful not to lose a friend
Mm, mm,
because you are all over the hedge. So I just think at and the other thing is about the identity of our kids.
right.
So and to me that's a complex situation whereby I have a bit of experience from back home. The people
Mm,
that were born here, as we expect them to have the same identity as us, they
right.
do, but at the same time there's a mixed part to it. And
Yes.
navigating that part, we are building a different culture entirely. Living in diaspora and having kids in diaspora, you're
Mm,
building a culture that you don't even understand, that is not scripted. But our
yes.
kids have the same experience and they share the same story, almost very similar,
Hmm.
but it's very different from what we are. So how do you teach what you haven't experienced?
Right.
So that is where I think the challenges come for the next generation in terms of the DEI, because
Okay.
the younger generations and their perspective of DEI is very different from us.
Yes.
Our script is based on our on our migrant experience, refugee experience. We come in here, we've thrived, we've started from nothing to what we are, or we are
Yeah.
still thriving. Our kids start on a different platform, and we're trying to teach them that same DEI that we have, and they're trying to teach you. So it's about, I think the next, and the thing is, it's not only isolated to maybe African community or emerging community.
Hmm.
It's all the established, the new, everyone, all their kids are on the same platform.
Yeah. Yeah.
So the challenges that we will have is to be able to map out what DEI looks like for the next generation.
Yes. That is the challenge. Wow. Well, Abiola, I could talk to you all day with regards to these issues. They're issues that face, I guess, any immigrant coming into Australia. So thank you so much for
Thank
taking
you.
the time to come and share your story with us today. Absolutely inspiring to see what you've managed to do with your life.
Thank
Great
you.
example of what is possible if you're determined to make it in Australia. So thank you so much for this interview.
Thank you so much for having me. And look, thanks for all you do for the community in the DEI space. I think, like you said, I've learned a lot. Being part of this about storytelling, it's a different perspective of sharing your story and let other people be inspired by it. So thank you so much for providing the platform to share the story.
And thank you to everybody who's tuned in today. The Diversity Connector is a platform that brings you a wide range of diverse voices, sharing our stories to uplift, inspire, energize you, or just to show you the way. So tune in again tomorrow when I interview yet another amazing guest. In the meantime, have a fantastic day, morning, or evening, wherever you are in the world, and bye for now. And thanks again, Abiola.
Thank
And that's
you.
a wrap, everybody, on today's episode of the Diversity Connector podcast. Thank you for tuning in and being part of our vibrant and global conversation. I'm your host, Gertrude Mache, and it's been an honor to share this space with you, where voices from all walks of life come together to weave a tapestry of diverse perspectives. Remember, every story you've heard today is a thread in the larger fabric of our shared humanity. So, as you step back into your world, carry these stories with you and let them inspire you to embrace and celebrate the rich diversity around us. Don't forget to subscribe, rate, and review our podcast to help us share these inspiring stories with more listeners. Do follow us on social media by looking for the Diversity Connector podcast for more updates. Until then, keep connecting, keep listening, and keep celebrating the beauty of diversity. This is the Diversity Connector podcast signing off. Stay curious, stay open,